right. So today on Titan Talks, we have Earl Brathwaite. So I'm going to give you a little bit of his bio here. Earl Brathwaite, specialist OBG with 17 years experience, medical director of the Venus Clinic, cosmetic gynecologist for 9 years. We need to talk about that.
Definitely.
Consultant OBG for Port of Spain General. Sole certified provider of Vagilano technique in Trinidad and Tobago. Vagilano.
Vagilangelo.
Okay, all right. I stand corrected. Vagilangelo technique in Trinidad. We're gonna get to that as well.
Definitely.
But what's it like having been a medical practitioner along the pathways of female anatomy for the past 17 years, and what changes have you seen over the years?
Well, over the 17 years, I've seen personally my practice shift more from just obstetrics and from treating things like fibroids and PCOS and endometriosis. And we're more diving into and heading into an era where it's more about preventative care, quality of life, markers, looking at dealing with those aspects of the care versus just treating, okay, there's a fibroid, it's causing bleeding, let me take it out.
Yeah, because I've seen Venus. Venus is your brand, and your brand has evolved into not just treatment, but I've also seen you evolve now into preventative care. I see you have little services branch off, like, aesthetic services. And then you have, of course, very, very revolutionary options now for women who have, let's say, lack of sensitivity in certain areas. You deal with a more proactive approach to female sexual health and that kind of thing. And I look at you avidly on the realm of social media. And I want you to delve a little bit into, for the layman, what do you mean by female sexual health?
Well, female sexual health is literally focused on ladies enjoying that aspect of quality of life where they can have fully satisfying intimacy with their partner. So anything that can impact that, be it psychological, emotional, mental, physical, changes with childbirth, changes as they get a little older, diving into perimenopause, and even some of the common conditions we just spoke of, the PCOS, the hormone imbalances, stuff like that. So what I've seen is that a lot of ladies have kind of held back on bringing it to light that they're having issues with these things.
Because as a society we need to be a little more open, because we need to. These are the difficult discussions that we need to have. The health and the wellness of our female population is what is going to allow everyone to be more happy and more productive. Because remember, they say happy wife, happy life. We can have a society when our women are,
definitely
enjoying less. But things like PCOS when it because my qualifications and my career and pathway, it hinges a little bit on yours, in the sense that as movement practitioners, as people that operate in the health community, we have to now deal with things like when a client walks in and she has PCOS. As a trainer, how do we deal with that? When it comes to PCOS and how it relates to fitness and a woman embarking on a fitness journey, how do you see it correlating and one affecting the other?
Well, PCOS is a pretty horrible condition. It's a condition that has a lot of variants, but the overarching issues kind of dive into like insulin resistance, obesity, and that insulin resistance, when your insulin levels are high but they're not functioning properly, it can make it very difficult for them to shift weight,
Yeah.
right? They're prone to water weight or water retention. And, they're also at risk of developing a lot of cardiovascular diseases early,
Of course.
right? Just from the whole insulin resistant pathway and how it impacts lipid metabolism, coronary artery disease, sleep apnea, all those things.
That's a lot of women needing professional assistance with respect to their goals in terms of
Yeah.
health and wellness and fitness, and getting a trainer, getting someone to assist them understands, even and of course that communication, that bridge between the practitioner and the physician is also of paramount importance. I'd have to say, leading us to conversations about fibroids, PCOS, endometriosis, and how these things affect women trying, as you say, to shift weight. Because we know that, as you mentioned, that insulin resistance, the cells increase in sensitivity with respect to insulin resistance when there is physical activity
Yeah.
involved. But we have a situation where how do we remain motivated if we're training? Now, when we're training and we're involved in physical activity, the cells are becoming more sensitive to the insulin,
Yes.
but we're not seeing the outward expression of our labor. We're not seeing the hard work manifesting itself physiologically. And of course, that can be demotivating. So, would you have any advice in that area for a woman who, she knows she's getting healthy, she knows she's seeing the results in terms of the blood work, but she's not seeing what she wants, not just on a scale, but she's not seeing in the mirror the person that she knows that she can be. What would your advice be on that?
Well, a lot of it is really now you have a condition which kind of puts you behind the bus. So for a normal lady who doesn't have PCOS and she doesn't have these health issues, women's health issues, it's still hard.
Yeah.
So when you add PCOS to this, you have extra hard.
Yeah.
So yes, we are getting metabolically and hormonally healthier,
Yeah.
workout by workout, sticking to a very disciplined and diet and nutrition aids. But you just have to really reassure that patient, that lady, that it's going to take a little longer.
Yeah, it will.
It's going to take a little longer for you. You're doing all the right things. You're heading in the right direction. You can use the lab work as a motivator. So
Use that as a quantifier. Use that as a
quantifier,
rubric.
yes. And you're getting there. Just keep going. Don't quit now.
Okay. All right. Is there a correlation, in your opinion, to a higher female sex drive and increased fertility and exercise? Do you think there's a correlation between, because as you remember, you mentioned female sexual health and your assistance in that regard, but there's some women who have low libido, and do you think there's a correlation positively, of course, between increased physical activity and increased libido?
Yeah, definitely. Ladies and everyone actually knows that exercise releases a lot of endorphins, which are feel-good chemicals in the brain. They reduce inflammation, they increase mood and stuff like that.
Yeah.
And it actually, makes ladies feel sexier the more they exercise. So definitely it's going to have a positive impact on libido.
Yeah.
So it's all, it's just a win-win.
Yeah, and in that regard, as a trainer for as long as I've been, I've also noticed that women behave differently with respect to physical activity and different phases in their period. Some women become stronger at different phases, some women become weaker at different phases. And then, so at any given time, I can have in front of me 3 or 4 different athletes depending on what part of her cycle she's at. And it's very, very important that we're able to understand that, and trainers need to be able to understand how to phase somebody's training. And on a day-to-day basis, it may be necessary to make a change, because you see, when a woman walks in and she knows she has PCOS and she knows she has various factors, we need to be able to give them that motivation as trainers, give them that push, and create an area for them to flourish and to triumph,
Yeah.
so that they can remain motivated. They can remain motivated, and they can have that subjective experience so that they can come back. So I'm really, really glad to hear that there's a positive correlation between their sexual health and physical activity, and of course with your intervention we could all win. you know what are your recommendations? Because we live in a society that believes that women are glass jars from the time they become pregnant. Do you think that a woman should exercise during her pregnancy?
I think so. We have little caveats with that, but generally, yes, exercise during pregnancy is good and beneficial. We have beneficial in terms of reducing pregnancy-induced hypertension, reducing gestational diabetes as diabetes during pregnancy developing, and also it helps to reduce postpartum depression, right?
Yeah.
So, however, there are some caveats, as I said earlier. Now, I usually would advise my ladies that if you are exercising before pregnancy, don't stop.
Right.
Now, at certain parts of the pregnancy, you may need to alter the workout a bit in terms of intensity, right? Because in the first trimester, we do have changes that can affect, your health as it pertains to exercises. For instance, the first trimester, you're prone to nausea and vomiting.
Right.
You're prone to dehydration and electrolyte imbalance.
Right.
So if you maintain that intensity that you were doing before, you're more prone to fainting spells and stuff like that.
That kind of thing, because the
Right.
body also is at a diminished capacity for manufacturing those substrates necessary for that sort of training and that
Exactly.
kind of thing.
And
So,
your intake is down.
yes, of
You're
course.
eating less,
Because of the nausea, some women become frightened to eat, that kind of thing.
Yeah.
But yes. And, but you touched on the postpartum depression and how exercise can affect it. Does it help, do you think that, training and fitness helps with respect to, and physical activity, of course, helps with respect to a woman bouncing back from pregnancy during that period when she's nursing, and of course, what is a sweet spot between when a woman has given birth and when she should restart her journey with respect to
Right.
physical activity?
Now, in terms of the bounce back aspect of it, I definitely think that there are great benefits in terms of maintaining that exercise schedule and making it easier for them to what we call lose the baby weight.
Right.
Right? Now, during lactation is a pretty marvelous period for most ladies who, have established lactation, breastfeeding, that kind of thing. We find that they do have an increased metabolism,
Yeah.
and they do have higher metabolism of brown fat and stuff like that. So that tends to help with the whole, bounce back look
Yeah.
and feel. So a lot of ladies actually lose a lot of weight with breastfeeding and lactation. So when they continue their exercise regimen, and that just helps to continue that fat oxidation, fat metabolism.
That's fantastic.
It's great.
Yeah.
Now, a lot of the issues with the bounce back is that a lot of ladies is the stress related with taking care of the baby, the loss of the sleep. So that's the antagonist in the picture.
Right.
So that high stress increases cortisol, less sleep, that kind of thing. So it's really, what I tell my new parents is that, listen, you have to organize this thing.
Yeah.
Mommy can't be up whole night.
Right. And then
daddies
expecting
need
to go to the
in.
gym.
Yeah.
And this antagonist that you're speaking about, I want to propose another antagonist. What do you think about the influence of social media on women psychologically trying to chase that image and trying to get back to that pre-pregnancy body? Do you find more women getting more into depression because of that, because of the proliferation of this imagery on social media?
I think it's definitely a factor because that peer pressure that is going to apply in terms of seeing, say, Rihanna, seeing, those type of people portray this like, okay, well, I had two babies, and look, I'm like that.
Which is a lie, because
Yeah.
they prepare for photo shoots, and then they do these photo shoots, and then they phase the release of the photos over months,
Over
and we are
months,
here
yeah.
thinking that this person got into fantastic shape in 2
Exactly.
weeks, and I could do it too, when in truth and in fact it is absolutely wrong. It's
I
erroneous.
remember they have in-house nutritionists, in-house trainers, in-house help.
Yeah, I tell my female athletes all the time that this is probably the most expensive thing that you'll do in your life, but it pays the best dividends. But unless you have the copious amounts of money that these celebrities have, you're not going to be able to live the life that
Yeah.
they are living. When you look at the price of food, especially here, the price of chicken breast to be eaten all the time, and then salmon, and then you have to punctuate with asparagus and different things to get different effects. You're not going to be able to be at the advantage of these people live their lives at. They have millions of dollars, nothing to do when the day come. And of course, you now have to go to work.
Yes.
So you have to train hard, eat right, go to work, and then get sleep,
Pay
and
bills.
then you and then take care of kids.
Yeah.
Regardless of the support that a man can give to a woman, children have this. There is women are nurturers.
Yeah.
And regardless, I've had the experience with one of my kids. I come home, I ask him, hey, listen, do you want something to eat? And I'll make something for him to eat. And then he puts it away and he wouldn't eat it. And then 5 minutes later, he'll go ask his mother,
Yep. Mommy didn't make it."
Mom, I'm hungry. I need to get something to eat. And then the missus comes and she's, hey, listen to me. Didn't I tell you to make something for, and I'm roughed up.
Yeah.
But I tried to feed the child, but some, children are very, very drawn, especially
Yeah.
boy children. I have to say they're very, very drawn to their mother.
Yeah, definitely.
And of course, so women definitely need that support, and of course we need to be very, very careful in the way we expect things. We need to manage our expectations with respect to social media, understand that it is all about paying bills, it's lies, and viciously so. And we as Caribbean people need to be very, very realistic. We need to go to work to earn money, to buy the groceries.
We have a different life.
And we have a different life.
have a different
And
life.
when we're looking at physical activity, we need to look at the entire 24-hour period as a cycle, and not just looking at a 1 hour here, 1 hour there,
Yeah.
because you're going to sit in traffic. You have your work to actually go do, which is sometimes in a lot of cases high stress, which then affects women differently as well too.
Yeah.
To then have to expect, this Rihanna or this J-Lo, this J-Lo body that everybody covets. Poor J-Lo. J-Lo can't make a bad move.
Well,
Yeah.
Hello. Wow.
And this is it. But have you it also what is like being a man involved in obstetrics, and as trainers, as male trainers, of course, we're stigmatized, and as male gynecologists, like I've been in the gym sitting down, listening to people looking for a gynecologist, and then Earl Brathwaite comes up, and everybody wants to know, where did he go to school, what kind of person he was in school, is he certified, he's handsome, can I trust him, you know what I mean? And, and you have this myriad of factors that work against you, you know what I mean? So what's your experience been in the past 17 years, being a man, being I'd have to say a good looking man, and what's it like being in the industry?
Well, I actually experienced a different impact, where when I asked a lot of my colleagues and a lot of ladies, the majority of women prefer a male gynecologist.
Okay.
Right?
Okay.
And I'll tell you why. I'll tell you some of the replies I got. So one is that there tends to be a disconnect with woman to woman in terms of having intimate conversations.
Right.
Unless that woman is your bestie.
Right.
Right? Especially a woman who is middle-aged. If it's an older woman, you may have that mommy feel, and some may feel, okay, well, I'm going to tell Tanti my stuff, because, she's been through it. She can give me some advice.
Yeah.
So that's one. The next thing is that the male-female dynamic is one where a lady tends to seek that kind of brotherly care, that
Right.
kind of spousal care,
Right.
in terms of confiding, laying their problems, having those discussions. Yes, there's a bit of a intro period,
Right.
where they feel you out.
Where you're on probation.
You're on
You're
probation. You're on probation. They're watching how you move, how you come in the room, your
Right, right,
mannerisms.
So
Is
in
this
other
a
words,
safe space?
male gynecologists are going to rule the world.
Oh,
is
wow.
what you're saying. Is what you're saying.
No comment. Maybe.
And then because I've watched the evolution of Venus Clinic. I've seen you guys have a line of merchandise. You've had your hoodies. I have no hoodie, by the way. I see the scrubs and stuff like that. What other
You get yours just
what other projects you if you care to disclose, like what other things you see coming into the future of Venus?
Well, Venus, at this point, we are very focused on kind of improving what I call customer service,
Right.
improving the foundation, the core, the women's health. We do have pediatric services. We do have psychological counseling and stuff like that.
That's really fantastic.
Yeah. We are diving into the aesthetic industry with
Right.
our esthetician / office manager / phlebotomist.
Right.
Yeah, that's Kashana.
That's right.
Shana
Yes.
Sully Skin. Yes,
Right.
I give her a little big up there. Anyway, so we find that we want to focus on services that make women feel good.
Right.
So yes, me and Izzy, we are there focused on dealing with the clinical problems, right? And then we have Kishana, we have our psychologist who is now dealing with the self-esteem, the confidence.
Right.
And we find that is a big thing with ladies.
Of course. You need
You
wellness. The body cannot go
Yeah.
anywhere without
With
the
men,
mind.
we just need muscles.
Well,
There you go.
That's
We
where we
just need-
hide. That's where we hide our pain. We hide our
There you
pain
go.
in our muscles.
To prevent pain, women want to feel good and look good.
Right.
So I'm feeling healthy. I feel good about myself. My body's functioning well. My period, my fibroid issues are sorted. My
Yeah.
endo pain is sorted. My PCOS is regulated. I'm good. But let me deal with my self-confidence.
Right.
Yes, we can have it from a skincare element, but
Yeah.
also have it from an emotional and a
But
mental
it's
element.
multifactorial as well.
Yes.
It is multifactorial.
That's why I divide the services like that.
Okay.
But coming on board, we deal it, as we touched earlier, with the female sexual health,
Right.
right? Actually, I read a meta-analysis, and it looked at worldwide incidence of ladies with sexual problems, and it's 40%.
That's a large number.
That's most likely underreported.
Of course.
And now 1 in 8, that's the number of ladies who report it as a distressing problem.
Yeah.
1 in 8. You understand? That's also a large
That's a
number.
large number.
That is, again,
Those are alarming numbers.
underreported.
Right.
And the key things that they look at in terms of the sexual problems are, lack of interest, lack of desire,
Yeah.
lack of arousal, inability to be aroused, inability to have an orgasm, and pain during intercourse.
Yeah.
And we look at one of the reasons why I'm diving into this is that if I look at the treatment modules that clinical medicine has for these things,
Yeah.
one is psychoactive drugs
Of course.
with a bunch of side effects. The next one is hormone treatments,
Which is touch and go.
which is touch and go, and which is, for us in the Caribbean, there is a sharp supply
Of course.
of those hormonal
Yeah,
treatments.
we have serious regulatory issues with
Yeah.
respect to the importation
Yeah, of anything.
of helpful medication, I have to say.
And the third tier is lubrication.
Yeah.
So imagine this, that's all you have for something that is has so much impact on the
Yeah.
quality of life of our ladies.
I think that has been overlooked for so long. 1
Yeah.
in 8 are scary numbers. Those
Yeah.
are alarming numbers. So I'm glad to see that you're pioneering in that field, and I know you'll do well because I all I've heard about Venus Clinic is fantastic things. The way you all pioneer customer service, everything. I think that you all do very, very well. I would like to see in Venus, maybe a health and wellness, maybe a fitness side to things, to tie in. A customer comes in or a client comes in, a patient comes in, and she has PCOS, or she has gestational diabetes. You have a reference point, or you have a small facility where they can be treated as well too, because of all the psychological and all the things that we mentioned earlier, the dopamine, the oxytocin, the feel good, the endorphins, and how it correlates. But I think that's also a beautiful field to get into. I think that the female sexual health is gonna take the forefront for now, because that's really, really important.
Yeah, very important.
But
definitely that's a good idea
Yeah.
in terms of incorporating that, and definitely will give it some deep thought.
we could talk about it later.
We will talk about it. Yeah.
Probiotics. What are your how important you'd say a probiotic is to a woman in terms of vaginal health and that kind of thing?
Well, probiotics in a supplement form, or I prefer them in your diet, in eating foods that have that probiotic nature in them, than just a supplement. Very important in both the vagina flora, maintaining a healthy pH balance and healthy vagina flora to reduce the risk of UTIs, recurrent yeast infections, recurrent BV, bacterial vaginosis. And because with less of those things, there are less deterrents to have satisfying intimacy in terms of vaginal health, as well as probiotics are also key in the gut health.
Right.
And the gut health is very important for the absorption of nutrients.
A lot of nutrients. People
and
believe that
reducing inflammation.
People believe that nutrients are absorbed in the stomach. There are a lot of nutrients that aren't absorbed until the small and the large intestine.
Yeah, definitely.
So gut health is health in general, And that leads us to vitamins. And what do you think about vitamins and female health and that kind of thing?
Yeah, definitely. There have been some links with vitamin deficiencies and fibroids, like magnesium. Magnesium glycinate has been shown to improve period pain.
Okay.
That kind of thing, pain from endometriosis and stuff like that. Magnesium and vitamin D. So there is some, it's a very complex pathway, but there is some link. With some deficiencies. And deficiencies don't necessarily mean you're getting less of the vitamin. Remember, we spoke about the gut again.
Right.
So you can have a deficiency and you're taking 10,000 IUs of vitamin D. You're deficient because your gut is not absorbing it, because you fed it a bunch of crap. You've killed your gut flora.
Right.
You have a leaky gut now.
And then of course some nutrients need the presence of other nutrients for proper absorption,
proper function.
and getting it to where it needs to go, to shuttle it where it needs to go.
Yeah.
What about in your experience, women's bone density, the osteoporosis and that kind of thing? Are you seeing more of that now, or are you seeing less of that? And at what ages?
Well, I think we're seeing. I think it's pretty stable. So we do encounter ladies with issues with bone deficiencies, mineral deficiencies, and stuff. We generally see them actually a little late in the Caribbean. Fortunately, the Caribbean ladies tend to go into the whole myriad of issues with menopause a bit later.
Right.
Unfortunately, they tend to have a longer perimenopausal period.
Okay, so what is the difference? What is menopause, and then what is this perimenopausal period?
So menopause is kind of a retrospective diagnosis.
Okay.
So basically, to qualify for menopause, you have to have missed your period not have a period for at least a year,
Okay.
right? So a year has passed since you haven't had a period and you have all the associated symptoms.
Right.
Right? The insomnia, the night sweats, all those vasomotor symptoms, along with other sequelae.
Right.
Perimenopause is the transition from having healthy ovulatory cycles,
Right.
right? If you don't have any hormonal imbalance, to where there is fluctuations and gradual decline in deficiencies both in estrogen, testosterone, and progesterone.
So as the lead
Until
up.
you read is the
So it's
lead
the
up.
lead up.
It's the
Okay.
lead up.
Okay. All right.
And actually, that perimenopausal period, that's when the ladies, that's the period that's ignored
Yeah.
the most.
Yeah. Because
know?
you're neither up nor down.
Yeah, you're neither
Okay.
up nor down, and the doctor's like, well, maybe it is this, maybe it is that.
Right.
And we tend to ignore that this lady's in perimenopause and may actually need preventative care to prevent the osteopenia, to prevent the osteoporosis, to prevent the cardiovascular impact.
Yeah.
By the time we diagnose her as menopause, okay, take this.
So you at Venus are basically looking to move away from that. You're going to do the treatment, but we're looking to move away from just treatment. We want to help prevent some of the
Yes,
issues
yeah.
as well. And I think that's a very, very
Quality
proactive.
of life, quality of life.
Yeah, and it's the first time. It's the first time I'm hearing a medical practitioner speak like that, and I think that's really, really that's fantastic, and it shows forward mobility with respect to thought, and we look to hear great things from this Venus monster that seems to be growing.
Venus monster, oh wow.
So the probiotics, we touched on the vitamins. Are you seeing the gestational diabetes? Do you see it lingering in women, or is it going as they come out of the pregnancy period? How long does it take before it goes away?
Oh, I mean, generally, it usually takes about 6 to 8 weeks for it to kind of supposedly get back to normal.
Right.
Now, about 50% of the ladies with gestational diabetes actually go on to have either pre-diabetes or overt diabetes. So it's definitely an area that we have to put a red flag on.
Yeah.
And
For
actually
sure.
follow up these ladies.
For sure.
And instead of just making them a statistic and just diagnosing the diabetes, that's where we need to now interject into that
Right.
immediate postpartum period.
Encourage that physical
And let's-
activity.
and
Encourage
let's
the
do something
testing,
to prevent.
the testing and the educational processes and
We
that
can
kind
cut
of
down
thing.
that 50% away,
That's a
away
lot.
lower.
That's a lot. That's a
Yeah,
lot.
There's a lot.
I didn't know the numbers were that high.
Yeah, it's 50%.
That's a lot, And of course, that period when a woman is, now getting into motherhood, having had that gestational diabetes is a situation where she needs to be able to now, she needs to take care of herself
Yeah.
so that she can be of more use to the child coming up.
Yeah.
So we have to encourage women to come out more, do more. I mean, women have had these Herculean tasks since the beginning of time. They have to endure the carrying of the baby, and they say it's 9 months. Is actually 10. It's 40 weeks. A pregnancy
Yes.
is 40 weeks. That's 10 months. I feel like we outsmarted them into it.
Wow.
It's not 10. It's not a year. It's 9 months. You just keep your belly for 9
And
months.
there's the postpartum period, what
Yeah.
we call the fourth trimester.
Right. So it's safely
Yeah.
a year. And they then have to now transition from having not just their bodies, but their lives a particular
Yeah.
way
Change.
to now having this young person, this parasite attached to them.
Wow. We should edit that.
No, from a biological standpoint, that's what it is. There is no value other than psychologically.
Dr. Brathwaite at the Venus Clinic does not
Support
approve
this
of that terminology.
But I jest,
Yeah.
or do I? But their lives have changed
Yeah, definitely.
permanently.
Yeah.
And they now have to manage a baby because daddy can't manage the baby if the baby is breastfed. We can do a little bit, but we have to
No,
now.
I feel we underestimate our role as men in this period, because there are a lot of things that we can do that not necessarily taking care of the baby, but taking care of the mommy.
Yeah.
And I think that's where the balance comes in. So while mommy's focused on baby, we need to be focused on mommy.
Of course.
Yes, we don't have any lactation mechanism going on there. Well, I mean, there are conditions like
I understand.
Let's not go in that.
Let's go in that direction.
But yeah, that's where we need to come in. We need to support the mommy as she supports the baby.
Yeah,
And that's key.
So they've had all these changes occur, and then they've had all these, of course, physiological trauma occur with respect to getting the baby here, and they now have these changes, and they now have to now incorporate physical activity when they didn't before, and they are now at risk because, a lot of women, they suffer from hair loss, they suffer from, some women lose their teeth. They have that decline in certain micronutrients that cause physiological effects that might be negative. So women have to be phenomenally careful because pregnancy could represent a constellation of dangers for women, and moving forward. But I think with the Venus Clinic and constant monitoring, and of course proper supplementation. Monitored supplementation, holding the hand of the physician like yourself, of course. I think that we could have a healthier society. We can have, we can have better mommies, and if we have better mommies, we can have better overall citizens of this country.
Yeah.
Because if a mother is able to be present and cognizant and everything, I think that's going to be the number one mitigating factor with respect to a lot of the things that we see going on in society now.
And someone asked me why I went into obstetrics and
why
gynecology.
did you go into obstetrics? And this is a little late in the game.
Yeah.
But why did you get into obstetrics?
But it's actually what you said just now. So I always see myself as someone making a big impact.
Of course.
And what bigger way to impact society, whether it be local, regional, international, than to take care of the nurturers of society.
That is brilliant.
Yeah.
And of course, you also have this huge responsibility of ushering new life.
Yeah.
I think that is one of the most beautiful things. I think there is nothing more beautiful than a pregnant woman, because she is now a god. She is giving life. While of course putting her life at risk because she's bringing life here. And of course, you usher new life into this world. You are, nothing short.
I am just the police
Just
of
police.
labor. Yeah, making sure law and order stays.
Of course,
stays there.
Of course,
I'm just there for safety reasons, really.
Yeah.
But there's something very satisfying from being present in that whole process.
Of course.
Where usually you'll have mommy and daddy there, and then you have their support system, either be, friends, family kind of thing. And you in the room, every time you come in the room, there's a lot of, maybe screaming,
Right.
maybe very, uncomfortable examinations, lots of monitors, that kind of thing. And then, the kind of agony exponentially increases during that pushing part.
Yeah.
And then as soon as the baby comes out, there is just a drop, in a sharp decline in pain and suffering to joy, and just
It's like flipping a coin.
is
And
intense.
you get
It's
to
intense.
and you
It's
get
like
to
magic,
witness,
actually.
Yeah, and you get to witness that.
There were 2 people there, now there's 3.
Right.
It's like magic.
You now have company.
Yes. Permanent company.
Permanent company. So yeah, I think that your job is very, very understated and underestimated in a lot of ways. And obstetrics, I think, is one of the highest pressures in terms of medicine because, there is this expectation of 100% success. You have
Safety.
the only, just like we have the only industry in the world that we have to look like what we sell in. You also are expected to be 100% accurate 100% of the time.
Hopefully, don't look like what we sell.
That is, you're fine. You're fine. But how has that been? That pressure, how do you handle that kind of pressure? You get a call, a patient just went into labor and you are on your way to, bringing a baby here. What are your thoughts? What are your intrusive thoughts? Are you like an athlete getting ready for a big game?
It's actually like a switch to me. I think the residency kind of prepares you for that, where there is kind of a sharp disruption in whatever you're doing, and you switch into game mode immediately. And your game mode kind of puts your thoughts in place in terms of, okay, this patient has XYZ, this YZ, and then you're like, okay, all I need to do is this.
So you're adding everything up, going through everything.
All permutations and combinations. You think of worst case scenarios and how do I prevent worst case scenarios.
Right.
And then think best case scenarios and how do I enhance that.
So on one hand, you are preparing for the worst, but you are now positioning yourself for the best outcome. Yeah, that is a lot.
And it's like that.
And
for me,
switch. Yeah, the switch. And I think most of the successful people in your field and in most fields, when it's time for game day, it's game day. And you're on. So I think that's really, really good. Are there any things that you would advise people to do, or women especially, who are actually planning pregnancy? And it's multifactorial. Do you recommend having babies before a particular age? And what are the things you would recommend for people who are trying to become pregnant?
All right. Now, one of the key things that I've actually highlighted in the practice and, seeing women over the years is that the risk status of ladies is actually going up. So we're finding that younger and younger ladies are actually having more comorbid conditions that are not diagnosed.
Okay.
And they only come out in pregnancy. I tell a lady that, hey, pregnancy will bring out whatever is underlying. So I think it's very crucial that young, older, all ladies really do a kind of a pre-conception wellness check.
A wellness check, yeah.
Yeah, so that's very important. For ladies who are attempting to conceive, get in the best shape in your life.
Yeah.
Right before.
Okay.
Live healthy before you conceive. Get cardiovascularly healthy. Get as lean as possible.
And it's reasonable because, the kind of testing that you do for the 40 weeks of pregnancy, some women may not have gone to the doctor for maybe the year.
Yeah.
And you are now facing a situation now where you have to go to the doctor once a month, once every 4 weeks. Yeah. And in the last trimester, I think it's every 2 weeks or so.
It's every week.
Every week.
Yeah, when you reach 36 weeks or so.
So pregnancy is something that's gonna, they're gonna uncover
a lot of things.
If you're not careful. So I believe that, you see, from another standpoint, medical as well, when at the point of conception, both parents become a snapshot and they join. So if it is you are in the best shape of your life and you are pushing that forward, that can relate into your genealogy and stuff like that as well. I think that we can become better versions of ourselves through the younger ones coming up once we are in the best shape of our lives, There are genetic factors with respect to, the diabetes and the non-communicable diseases, but a lot of them are lifestyle as well too.
Yeah.
And in the pursuit of us becoming in the best shape, we are going to have to make changes. And, a lot of those changes are going to be nutritional and lifestyle. And,
Yes.
and of course, those things are going to translate into better pregnancies, better quality of life, better children, because we see, I deal with children as well, too. And I see a correlation between, there are a lot of children coming up now with motor skill issues. And they have trouble, recruiting their own muscles, recruiting their own limbs, and they're doing things later because they have these tablets and they have these various things. But they're also born in a different time altogether with different types of parents. My grandfather speaks about a time where women would give birth on their own, and they would have dinner ready for their husband when he comes home, and the baby in the carriage, and to now we have people like yourself ushering new life into the world. And I understand the factors that are involved, and I understand that this is a new time where we have more information to interrogate. We have new mechanisms. We understand the human body a lot better, so we know better than to do things like that. But the old people believe that they are, and they were better. And then, of course, we have these kids, and it correlates because we have these kids coming up now, and they are at a disadvantage. But they're at a disadvantage based on the rubric of what the old world and the old school would have said. We are now in a different world. Children are required a lot less now to have that physical activity. But we need to have the conversations, and we need to put forward the platforms and the mechanisms and the conduits for these children to come out and to become more active.
Yeah, definitely.
They're going to become better adults through that.
Yeah.
So... I'm going to advise everybody to check out Dr. Brathwaite's page.
Oh wow!
Go to the Venus Clinic. Get on Instagram. Look at those Venus baby stories. And of course follow the Venus Clinic for more information.
Yeah, man, thanks.
It has been my pleasure having you here.
Same here.
It's always a pleasure when we get together. We have that reasonable discourse.
Yes, for sure.
And of course, I look forward to having you on future episodes of Titan Talks.
Yes, it went.
Of
I'm
course,
there.
So if with all protocols respected and whatnot, we're gonna kill it here.
Yeah, bro. Bless.